Hello everybody, welcome to my channel. If you're new here, my name is Dr. Bhasha Mukherjee. I'm an NHS junior doctor, model and former Miss England. So today we're actually be covering a topic that I already filmed for and I deleted the video off, and that is my experience of PRP or platelet-rich plasma injections, okay, for my hair. So PRP stands for platelet-rich plasma. PRP injections are essentially where the patient's own blood is drawn. It is centrifuged to separate out the plasma. You can see a picture right here. The yellow portion is the bit that we're interested in. That's what the plasma is. You take that plasma and use it almost like a medicine, okay? And it can be injected in various parts of the body. It promotes regrowth, regeneration, and healing in the body, okay? So the few areas that this plasma has been previously tested in and injected in have been in joint spaces for arthritis and intra-articular inflammation, so joint inflammation, in tendons, in muscles, in muscle strains and ligaments, and mainly orthopedic procedures. And this had been happening since the 1980s. I first found out about PRP as a concept on my travels as part of Miss England. I was in India and I was being hosted by an orthopedic surgeon there who was explaining to me that he has this clinic where he does PRP injections for people in their joints, and he said to me that he was at the time treating a dancer who would come to him for getting her knees done because she had really bad knees from doing her dance and all. And at the same time, what he'd been doing is he'd also been injecting this PRP in her fine lines and wrinkles as a substitute for Botox. And actually it had some amazing effect. So your blood has multiple different functions. Blood carries oxygen, nutrients, vitamins, minerals, gases. It also takes away the excrements, any sort of excreted gases from respiration, and any sort of waste that your body needs to get rid of. It carries it out from it as well. But apart from that, it contains immune cells, growth factors, hormones, so it actually does so many functions, and it communicates with the body. And equally, it's there to detect when there is any damage or any sort of injury to any part of the body, and your blood rushes to that area and tries to wall it off. And that's how we protect our body from infections and viruses and lots of other things. But the plasma has lots of things dissolved in it. It's got proteins dissolved in it. It's got vitamins, minerals, salts, sugars, and it also has growth factors in it. And it also contains your platelets, which help with essentially the healing process wherever you get a cut or an injury anywhere. And it promotes that cell regrowth, that cell repair and cell regeneration. And that is what we are interested in. And we inject plasma into areas of inflammation in different parts of the body. It has a similar effect, or has been seen to have similar effect in places like your joints or any place of injury. It also becomes really useful in your skin because when it's injected just under the skin, in not in the muscle layer but just the layer above the muscles, it promotes collagen growth. Okay, so actually it's been noted that when you have PRP injections in your fine lines and wrinkles, the effect is more profound with less of the side effects of things like Botox. What Botox does, it freezes the muscle so you can't move it, so that's why you don't get the lines anymore so much. Whereas this, it works on a layer above the muscle, so you can still move your muscles, but it promotes collagen growth, which gives your skin that elasticity back again, and it can help for the wrinkles to sort of, your skin kind of can do this rather than being stuck in one way, which is what happens with Botox. Which essentially is what we lose with age. When our skin ages, we lose collagen, and that's what makes everything sag and kind of become wrinkly and kind of become a bit loose and horrible. And when we give that collagen back and promote that regrowth and repair in that part of the body or in the skin, then, the skin starts looking all youthful again. Now, that's one way of doing it. The other way that PRP has been used in the skin has been with the vampire facial. I don't know if you've heard of it, but the vampire facial, essentially, you do microneedling and you just sort of rub in the patient's own blood and use it almost like a serum on the face, okay? So what that does is you're creating micro injuries to the skin, which promotes your body to send its own defenses to those areas and create healing in those areas, and also tiny little scars are formed in those areas. But remember, scar tissue is quite tight as compared to normal skin. So imagine lots of tiny little scars are made in the skin. So overall, when the skin heals, it's going to be tiny little scars that overall make the skin tighter. Okay, so you're not only doing that from the inside, but you're topping it up by giving that serum, that blood, that plasma on top, using it as a serum. So you're almost doubling the effects. Your body is pushing all the healing properties from inside, and you're giving it from the outside as well. So you have an overall, like an explosion of healing and repair on your face. A similar concept has been used for hair as well, where in areas where you have hair loss, for example, they have tried to put PRP injections just under the skin, just in the scalp area, in those areas where hair growth has been diminished. And, in combination with other treatments, this has been found to be really helpful. And one of the other treatments that they've tried is mesotherapy, where instead of injecting the plasma, you actually inject certain vitamin serums and stuff like that. Okay. And the concept behind it is very similar, again, promoting repair and encouraging regrowth, okay? And hair, essentially actually comes from hair follicles. And in order for those hair follicles to be active, they need to sort of be in the growth phase. And by injecting the platelet-rich plasma, you're encouraging growth, you're encouraging healing. And that's why you can see some new hair growth, because some of the hair follicles that were a bit dormant, a bit dead, a bit, can't be asked, they sort of start refiring again and start producing new hair again. What they recommend is you do 4 sessions of PRP, about 4 weeks apart. So a total of 16 weeks treatment, roughly. And then to keep up the growth, you can just top it up by doing 1 session a year. For me, I only did 2 sessions, about 4 weeks apart. And I was told that I will notice hair growth within the 2nd week of having had the treatment done. First time I had it done, I did notice some hair growth. And actually I noticed hair growth mainly in these areas where I have already quite a lot of baby hair, okay? But my main problem with my hair is actually, I'm going to show you, is over here. As you can see, I've not got a pronounced bald patch, but I've got thinning. And I've had thin hair at the top of my hair for as long as I've lived. And it's becoming more pronounced now that I'm getting older, I will admit. But even when I was a baby, I had hair like this emoji, okay? I had hair around the sides and nothing at the top. So my mum was convinced that I was like going to grow up to look like a bald man. But here we are. That's just how my hair grew. I've got a lot of hair at the back, but I've got thinner hair and kind of a bit of a messed up hairline at the front. And I've always had a big forehead. It runs in my family. Balding and hair loss runs in my family. So I'm sort of screwed in that regard as well. One of my friends actually said, and she's got much more pronounced hair loss than me, she actually said that she went through the whole procedure. She had some initial hair growth, but then they eventually fell out anyway. So she felt like she'd wasted her time a little bit on it. So that made me a bit doubtful. I was like, hold on. And this is no shade on people that are doing PRP treatments. I still think that it's a very novel, amazing concept, and it's so effective on some people. But I just want to give you that forewarning that it doesn't necessarily work on everybody, okay? And it's especially useful in people who've had a recent procedure done, like a hair implant or something like that, because then you've actually implanted hair follicles, new hair follicles into the scalp, and to keep them healthy, this could be a really good thing. I went into it non-judgmental. I was asked to make sure I drink plenty. Thankfully, for this procedure, I didn't need to have any kind of like a pre-testing or anything like that, because at the end of the day, this is your own blood. So you're not really going to have an allergic reaction to it. But I will say that they do apply a cooling jelly and a local anesthetic jelly on your scalp. And by all means, if you think that you could be allergic to that, get yourself tested with that to see that you don't have any reaction to it. They asked me a few questions and a few health questions, which might be relevant. Certain people who are more prone to bleeding or infection or immunosuppressed, it's helpful to know your past medical history, because first of all, this procedure involves taking blood and all these things, and the person who's doing all this, they're exposing themselves to you and your blood essentially. So if you've got a bloodborne virus or anything like that, then they need to know. So, let them know these things in advance. And I don't know if that might be something that stops you from having the procedure, but it's always helpful to let them know, and they'll ask you these questions. So don't get offended if they ask you about if you've got any past medical history. It's also helpful to know if you have anything that suppresses your immune system, like, for example, cancer, if you're having chemotherapy and all these things, because all these can actually limit the effectiveness. Certain medications can limit the effectiveness of this treatment. For example, chemotherapy itself, it sort of targets fast-growing cells, so it will target your hair cells as well. So it might not work that well if you're on chemotherapy or anything like that. Equally, you're opening up multiple little areas and sites for infection. So if you're someone who's prone to infections, it's important for whoever's conducting it to know about this. And they might even, have any contraindication to doing the procedure then. So, be aware of this. And if you're someone who is a bleeder, if you've got hemophilia or, blood thinners and things like that, they took my blood, just normal from my vein in my arm. They'd also put lots of this numbing jelly on my scalp. I think it's really difficult with your hair in the way to sort of truly be able to numb the scalp. It works a lot better on your skin, obviously, because the hair is not in the way. They put the blood in a bottle in the centrifuge machine. It's literally like a merry-go-round for your blood, which is spun around really, really quickly. And what it does is it separates out the thicker portions of the blood, which is your red blood cells. They sink to the bottom, and it separates out this yellow component of the blood right here, which is what is rich in all the things that you want to inject, essentially, okay? Once you've got this sample, it's then drawn into syringes. I had about 7 milli tiny little syringes worth of plasma to have been extracted. And what they do is they take the syringe and they just inject it just under the skin, like in multiple different areas, and they just go at it all over. So they went all around this area for me. I did not realize how tender and how sensitive your scalp can be. It was super sensitive. It was it felt like tiny little bites, like snake bites almost, okay? And that was the first time. By the second time, I knew what to expect, so it became much more predictable. And I want to also mention that it's over within a few minutes, so it really doesn't last very long, and they will stop every time you want to stop. So if you feel like, oh my gosh, I can't cope with this pain, you can ask them to stop and they will stop, okay? But it's bearable, okay? And in terms of pain afterwards, I'd say you get a bit of a dull headache at most after you've had the procedure. It feels your hair feels like someone's actively pulling it afterwards. It feels like someone's pulling it. It feels like tight almost. It's a really strange feeling. And it probably lasts a couple of hours afterwards. Within about an hour or two, you don't really feel anything, you forget about it. I will recommend that my aftercare that I was explained was, do not wash your hair for at least 48 hours. Definitely don't shampoo it, because when you're washing your hair, you're exposing it to water, which is actually not as clean as you might think. It actually contains lots of germs in it. Our body just copes with it. But, you've got entry points which you don't want to expose germs to. And what they say is do not wash off the plasma, leave the plasma on, because the longer it stays on your scalp, the longer it has to work and do its thing. So just leave it on. So my hair kind of looked like this, which I won't say it's a bad look. I think it's not a bad look at all. I kind of looked a bit sexy, but yes, I did look like I had a lot of dandruff going on, because when the plasma dries, it kind of looks like a cross between dry gel and dandruff. But at the same time, I will say that it's not a bad look. It kind of acts like gel. So I was kind of happy with the way it looked. And after a day or two, you can also use a comb or a brush on your hair if you really want to. Your scalp might feel tender and a bit sensitive in certain areas, but as I say, it gets better really quite quickly. Okay, so I'd say within about 72 hours, it was fine. And as I said, the first time I got it done, at the 3-week point, I noticed some hair growth, and but the second time I didn't really notice that much. It's really difficult to compare, because hair is one of those things that unless it's sort of just suddenly everything changes, you don't really notice those subtle changes. So we'll say that. But as I say, I got some hair growth mainly in these areas: infection, bleeding, pain. You can get scarring from it. Some people, they actually even get the inverse effect where it causes an inflammatory effect and you can get some hair loss from it. But the worst thing that can happen is that your hair does not grow, or the procedure doesn't really have the desired effect, okay? But there are other risks related to actually drawing your blood. You could introduce infection that way. You could cause more bleeding that way. You could have an allergic reaction, an anaphylaxis reaction even, to the scalp product they use. But the good thing is that the active ingredient is your own plasma, so you're less likely to have a reaction to your own blood. I got it done in London, at M&K Aesthetics. It's right next to Bank Station. Really lovely group of people, lovely group of ladies that run it, and it's a really lovely, pleasant, environment to go into. So I'd recommend the people and the place that I got it done at. I had 2 treatments that were complimentary, but at M&K Aesthetics, I can speak for them, it is about £250 per session. So for a total of 4 sessions for 1 year, well, for one whole session essentially, it will be about £1,000, okay? But if you get all 4 together, stacked up together, and you book them together with M&K Aesthetics, then you can get it at a discount at £900, which is £100 less than what you would normally pay. I personally still think that the problem that I started off with, it's not gone away. So there you have it. That's my final verdict. It is a treatment that works for a lot of people. And I'll be lying if I say that it didn't have some hair growth, but it's a very individualized thing. That is the video on PRP. I'm really hoping I don't forget and delete this video. If you guys have any questions, tips, any particular thing that maybe I should have done differently for my procedure, then drop it in the comments. If I forgot to cover anything, drop it in the comments below as well. Thank you so much for watching this video, and now it's almost time for me to go to work. I've got 20 minutes left to go to work, so I'm gonna get ready for work. I pretty much am, but I am wearing pajamas, so I'm gonna change my bottoms and get ready for work. Thank you so much for watching. Don't forget to like, comment, share and subscribe to this video. Bye bye.